You've been struggling with neck pain for a while now, and you're wondering why the doctor will not order an MRI. Or you've been struggling with neck pain and you're wondering if you need an MRI. Well, today's video, this is a question we're going to answer, and it's a very pertinent one for me because I just had a conversation with one of my best friends about that this weekend. So many people who have been struggling with neck pain feel like they need an MRI and don't understand why their doctor won't order one. Or they haven't gone to the doctor because they feel like that's not going to be helpful. They're just going to throw pain medication and muscle relaxers at them, which isn't going to solve the problem, and tell them to go rest for 2 weeks, which they've already done all that, and it doesn't help anyway. So what's the point in going to see the doctor? However, you do have to go see a doctor if you want to get an MRI. And so people are wondering, should I go ahead and go to the doctor in order to be able to get that MRI? So today we're going to talk about what can the MRI show, as well as what can't the MRI show, because that's really an important question when you're considering whether or not you need an MRI. And I'll tie this up together by telling you my friend's story, as well as what I told her this weekend. Let's start with what can an MRI show? First thing, an MRI can show a lot of things, but I want to tell you with a word of caution, there's a lot of research out there that shows that the MRI does not necessarily show what is causing your pain. After the age of 20, our vertebral discs, which is in between each of the vertebrae, you have those spongy discs, does not have a direct blood supply. So what the research is showing is that after the age of 20, we start having some degenerative changes that we can see in our spine and in the discs. And I can tell you there's been plenty of evidence out there now at this point, particularly with low back pain, but the neck's basically the same thing, that show that after the age of 40 and definitely after the age of 50, there are degenerative changes in our spine. Now, you may be saying to me, well, Dr. Amy, you said that every tissue in your body is designed to heal itself as long as it's moving correctly. And I would say to you, yes, and that remains true. So what I'm telling you is that after the age of 40 and 50, our spines do not move correctly, which means that the joints don't get the nutrition they need and the discs don't get the wringing out they need to bring in the nutrition and allow for total healing. And I will tell you, there's plenty of research out there to support this, that over time there are always degenerative changes, but that's not necessarily what's causing your pain. So, what can you see on an MRI? The first thing you can see is if there's worn out joints or arthritis in the joints. So again, if the joints are not gliding correctly, they're not going to get the proper nutrition in order to heal. You can also see a bulging disc or a herniated disc, or if there's any damage to the disc at all. Now, discs require rotation in order to get the proper stimulation for healing, and many of us do not rotate properly because our spines are not properly aligned. So the majority of people do have disc issues in their neck and in their low back. They just don't know about them because they haven't had an MRI. An MRI can also show if there's a nerve compression issue. So most commonly, this will be due to the joint or to the disc that will be putting pressure on the nerve. Now, what the MRI can't show is if there's an extreme amount of inflammation that's irritating the nerve root. So that's a different thing than if there's a true compression. MRI can show the compression, but doesn't necessarily show if there's a large amount of inflammation that's irritating that nerve. And the MRI can show if there's a disease process that's affecting any part of your spine, which may be important in regards to if you even have access to normal motion. Now, the really frustrating part for many of my patients, and as it turned out my friend this weekend, is that the MRI cannot show if there's a muscle strain or a muscle issue. Now, obviously, yes, the muscles do show up on the MRI. However, it doesn't show if there's a problem with the muscles, if there's too much tension, if there's a strain, if there's something going on. Now, if there's a tear in the muscle, yes, the MRI is going to show that. But commonly when we're talking about the spine, that we're less likely to have a tear. We see those more in like the hip or the shoulder or something like that that's a little bit more mobile. And this gets really frustrating because my patients go in and get an MRI of their neck or their low back, and they say, well, the doctor says that nothing is really relevant But look, there's all this stuff on the report, which is exactly what happened to my friend. So she had a work injury and she went to the general practitioner who told her to take pain medication, muscle relaxers, and rest for 2 weeks off of work. So she did all of those things as she was told, and her symptoms did not improve, and she did not feel safe to going back to work because she has a pretty physical job. So the doctor sent her to a specialist, and the specialist ordered an MRI. Well, she just got the MRI report back last week, and she has 5 bulging discs in her neck. 5 bulging discs. So, she's my friend. She's a little bit older, okay? Now, luckily, she saw a fantastic specialist who told her, yeah, I know you have 5 bulging discs, but you had those before your injury. To which she responded, quite reasonably, how do you know? And he said, because you can see that these things have been here for a while. So the thing is, when there is a bulging disc that has been there for a while, this is even true with a herniated disc potentially, you can see some changes in the joints and the tissues surrounding it that tell you this is not a new thing. You can imagine how frustrated my friend was because she just found out that she has 5 bulging discs and she has all this pain, but she's had the bulging disc forever, but she didn't have the pain. So luckily, fantastic doctor explained to her that what was happening is she had this muscle tension that was causing increased compression through the disc that was irritating everything in her neck. So what does she need? You already know the answer. You've been on this channel for a while. She needs some physical therapy. So she started physical therapy this week in order to loosen, stretch, strengthen those muscles to decrease that pressure on the discs so the disc will stop being irritated. And for her, the muscle tension is also leading to headaches, so it will help with that too. So when she called me this weekend to talk to me about this, she was like, can you believe what this crazy doctor said? And clearly he doesn't know what he's talking about. I think I need to find another specialist. And I was like, no, you actually found an amazing doctor because he told you the truth. He explained to you that these disc issues you've actually had for a long period of time, but the injury caused a muscle tension issue that is what was actually causing your pain. The great news about this is that means this can be fixed because what you're actually suffering from, what is actually causing your pain, is the muscle tension issue. Now, if she gets a muscle tension issue under control, she can actually do some exercises then to improve the discs in the long term and improve her long-term outcomes, which, she's my friend, so I'm going to be on her about that in the long term. Right now, we're just trying to make sure she gets out of pain. So I hope that that is helpful and encouraging to you. If you feel like I got an MRI and it looked horrendous and I don't know what to do, why is my doctor not doing surgery? That's probably why. And I'm hoping that you have a fantastic doctor and they explain that to you. And I am hoping that this is just confirmation of everything they said so that you feel encouraged that other people see things this way too. The challenge is that many of us were raised when MRIs were new and they were thought to be this miracle thing that we could see what was going on inside the body. And to some degree, that is true. However, we also found out that there's a lot of things that were going on inside the body that we just didn't know about before. So now that MRIs have been around for a while, we're starting to be able to look at people who have never had pain and understand and compare how their MRIs look. And what we're finding is that there's not necessarily a difference between the symptomatic people, the painful people, and the asymptomatic people or the pain-free people. So if you have an MRI that is just full of words that you don't understand and you have been questioning why your doctor's not recommending surgery, I hope that this helps make sense of this question for you. All right, to review, what can an MRI show? It can show a joint issue, it can show a nerve issue, and it can show a disc issue. What can an MRI not show? It cannot show if there's a muscle tension issue, if what you're suffering from is more of a compression issue because of that muscle tension, or even if you have a malalignment issue that is really what is the root of your cause. If this video was helpful, boop that like button because that helps the algorithm, and don't forget to subscribe for more great content.